Continuing here with the Rh incompatibility issue. So this is a common problem when you have an Rh negative mother and she's pregnant with an Rh positive baby. Then usually the first pregnancy is fine, but latest at birth, the mother will be exposed to her baby's blood, which is Rh positive, and so she will start making antibodies. She doesn't even have to be given the blood. Just at birth, she will naturally come in contact with Rh positive blood, and that will stimulate the formation of Rh antibodies. Now, in subsequent pregnancies, if she's pregnant again with an Rh positive baby, then these antibodies will cross the placenta and will cause this hemolytic disease of the newborn, otherwise known as erythroblastosis fetalis. I'm going to write that down. So in any second and subsequent pregnancy, if she's pregnant again with an Rh positive fetus, then these anti-Rh antibodies that she's made after her first exposure, they will kill the fetus, and it will lead to a miscarriage every time. So these were women back in the day when this was not understood. They would have one pregnancy, and then every subsequent pregnancy would end up in a miscarriage. Nowadays, there is a way to prevent this. It's called a RhoGAM shot, which absorbs those antibodies, these Rh antibodies, anti-Rh antibodies. And again, the disease is called hemolytic disease of the newborn, or otherwise known as erythroblastosis fetalis, fetal referring to the fetus. It is fatal too, but it's here the term refers to the fetus. So here's what happens. Hemolytic disease of the newborn. So you have the Rh positive father, the Rh negative mother, and Rh positive is dominant. So now she will have this Rh positive baby right here. And first exposure is fine because that usually happens late in pregnancy when the baby is almost ready to be born, and so it's not going to damage the baby at that point anymore. But she will make these anti-Rh antibodies. So the response to the Rh antigens, the mother will produce anti-Rh antibodies, and then any subsequent pregnancy, these antibodies will cross the placenta and kill the poor fetus every time. Now, luckily, these days, there is a shot available that will prevent the erythroblastosis fetalis. It's called a RhoGAM shot. But now let's move on to other type 2 cytotoxic reactions. And here are 3 listed. There are drug-induced cytotoxic reactions. The first one here is thrombocytopenic purpura. In this case, the platelets combine with drugs, forming a complex that is antigenic, and then the antibody and complement will destroy the platelets. And then you end up with thrombocytopenic purpura. And I'll show you a picture in a sec. Agranulocytosis, there you have drug-induced immune destruction of granulocytes. And then hemolytic anemia, that is drug-induced immune destruction of red blood cells. There's a figure that shows you the process of how somebody might end up with drug-induced thrombocytopenic purpura. So here we have a drug which acts as a hapten. By itself, it will not be considered an antigen. It doesn't have any antigenic properties, but combined on the surface of a platelet, now all of a sudden this thing looks to your immune system as if it needs to react to it. So this the drug binds to platelets, forming a hapten platelet complex. Then the complex induces the formation of antibodies against the hapten. So now your immune system recognizes the drug here that's sitting on the platelet. And then once these anti-hapten antibodies are available, they will bind here to the surface of this, and the action of these antibodies plus complement activation will cause platelet destruction, and that leads to thrombocytopenic purpura. Now moving on to type 3, immune complex reactions. That's another type of hypersensitivity. So here you're making antibodies against soluble antigens in the serum of your blood. So we're forming immune complexes that lodge in the basement membranes beneath the cells, and in the end they activate complement, causing massive inflammation. An example for this would be glomerulonephritis. That's inflammatory damage to the kidney, the glomeruli of the kidney, due to immune complexes as a result of infection. Here's a figure that shows you the formation of an immune complex mediated hypersensitivity. So here's your immune complex, the whole thing. That's an immune complex. You have antibody, antigen, another antibody right here. So this thing is deposited or sort of inserted in the basal membrane of a blood vessel. Now, anytime a antibody has found its target, the antigen right here, the stem region will expose a binding site for the first component of complement, activating complement. And so the problem here is now that the presence of these immune complexes activates complement, and then you get a lot of inflammation, so you get attraction of inflammatory cells, a bunch of neutrophils will be coming around, and you have a lot of destruction there happening. So these enzymes released from the neutrophils, they will cause damage to endothelial cells of the basal membrane, and they can cause leakage then of blood as well. Here our last type of hypersensitivity, that's type 4, delayed cell-mediated reactions. So here we have cell-mediated immune responses caused by T cells, and they're generally called delayed hypersensitivity reactions. So here you have antigens that are phagocytized and presented to receptors on T cells, causing sensitization, and then re-exposure to the same antigen causes memory cells to release destructive cytokines. And so here contact dermatitis is a very common example for that. So here we have allergic contact dermatitis that happens. So these are small particles. They like latex, for example, they will combine with proteins in the skin, and that then the hapten becomes an antigen, of course, that's seen by your immune system, and then you're producing an immune response. And here are some examples given. Poison ivy, some cosmetics can cause this, metal ions. A lot of people have nickel hypersensitivity, and then also latex glove type of contact dermatitis. So here is the development of an allergy. In this case, here we're talking about the poison ivy plant. So here's the poison ivy, and it has these chemicals that then will combine with skin protein. So here are the chemicals from the poison ivy, the poison itself, and they combine with the skin protein. So these by themselves will be haptens, but together with the skin proteins, they produce an allergic reaction. And then you're going to have the primary contact will not lead to a reaction. You're just activating these T cells, these T memory cells, that then on a secondary contact, they will cause the T cells to be activated and release cytokines, and they produce then the dermatitis, the inflammatory response. Here you have an image that shows somebody's hand that has allergic contact dermatitis, for example, after exposure to poison ivy. Moving on now to autoimmune diseases, and those types of diseases are much on the rise these days, and so that's actually a really big concern, because now you are aiming your own weapons against yourself. That means your immune system responds to your own surface structures and starts destroying them. So it's basically self-destruction, and it causes a lot of damage to organs. So basically your immune system has lost self-tolerance. It has lost the ability to distinguish self from non-self. Sometimes people think also that we get autoimmune antibodies as a cross reaction. So let's say there's some virus and you got infected with it, some rhinovirus, maybe just a common cold, and your immune system made antibodies against the virus, and they happen to cross react against that with a surface, with some of your surface structures, and then causing the destruction. Either way, if you have an antibody that binds to your own body structures, that's very dangerous and highly destructive. So we can have different types of autoimmune diseases. They could be cytotoxic, immune complex type of immune diseases, or cell-mediated autoimmune diseases. Let's take a look at that. So cytotoxic immune reactions first. Autoimmune reactions, that is, the antibodies react with cell surface antigens. Examples for that would be Graves' disease, where you're making antibodies that mimic the effect of thyroid-stimulating hormone, TSH, from the pituitary. They will bind to receptors in the thyroid gland and stimulate the thyroid gland to make massive amounts of thyroid hormone, which then leads to something called hyperthyroidism, and typically also a goiter. So that's Graves' disease. MG, myasthenia gravis, is another one of those cytotoxic autoimmune reactions. There you're making antibodies that coat acetylcholine receptors. And if you're coating the acetylcholine receptors in skeletal muscle, then the muscle will no longer respond to the nerve signals from the motor neurons. And so that means that you're going to have muscle weakness at first and then ultimately paralysis. But MG, one of the hallmarks of myasthenia gravis is that people have drooping eyelids. That means their muscles in the eyelids are so weak that they can't even hold up their eyelids, and so the eyelids start drooping. So one of the hallmarks of myasthenia gravis. Let's move on to immune complex autoimmune reactions. Here we're making immune complexes of antibodies and complement that are then deposited in tissues. And here examples would be systemic lupus erythematosus. There we have immune complexes formed in the kidney glomeruli, for example, or rheumatoid arthritis, another example where the immune complexes form in the joints. Now, next one is cell-mediated autoimmune reactions. They are mediated by T cells that attack tissues. So there's type 1 diabetes, is completely insulin-dependent diabetes mellitus. So type 1 diabetes, there you have T cell destruction of insulin-secreting cells, and the beta cells in the pancreas are being destroyed by T cells. Psoriasis and psoriatic arthritis, another example of cell-mediated autoimmune reactions. Those are autoimmune disorders of the skin. Next, let's take a look at reactions that are related to the human leukocyte antigen, or HLA complex. So HLA comes from human leukocyte antigen, HLA complex. Now here are some definitions for you. The histocompatibility antigens, those are self-antigens on cell surfaces. This is how your immune system basically knows who you are. It's sort of your antigenic profile for self-recognition that's necessary for your immune system to not attack you. The major histocompatibility complex, the MHC, those are genes encoding the histocompatibility antigens. Now, the human leukocyte antigen complex, the HLA complex, those are the major histocompatibility complex genes in humans. And certain HLAs are related to increased susceptibility to specific diseases. And let's take a look at some of these diseases. Well, some of them we already mentioned in a slightly different context, but on the inflammatory side, you have autoimmune diseases, multiple sclerosis, and rheumatic fever. On the endocrine side, you have Addison's disease, which is related to cortisol production, and so that is related to the adrenal glands. And then Graves' disease, we already had that one. That is hyperthyroidism, where you're making antibodies that are mimicking the effect of TSH, thyroid stimulating hormone. And then here's also the malignant disease that's related to HLA antigens. So that's Hodgkin's disease right here. Also related here to the HLA complex is the whole issue of tissue typing and tissue matching when you have an organ transplantation. So typically what needs to be done before an organ can be transplanted between people, you need to do HLA typing, and then you need to, the best you can, match as many HLAs as possible. So in transplant surgery, the donor and the recipient, they must be matched by tissue typing, and if it's not a good match, then most likely, almost with certainty, the recipient organism will be rejecting the transplant. So the better the match is, the better the chance that the graft will stay. And the HLA typing uses standardized antiserum monoclonal antibodies for the specific HLA. So here, tissue typing is done using the serological method. So here's in green is the lymphocyte to be tested, and these are the HLA, the antigens that you want to find out what specific type somebody has. You're using anti-HLA antibodies, and they will attach to their target if they find it. Here, in this case, the golden triangle. And as you know, when an antibody finds its antigen, then on the stem region of the IgG, the binding site for complement becomes available, complement gets activated, and the result of complement activation is tissue death, because you're drilling a hole into the target cell. In this